Namaste to all. So, Chaturmukha Samarambham, Vaghadacharya Madhyamam, Asmadacharya Paryandam, Vande Guru Parampara. Respected dignitaries, Dr. Vikas, Dr. Navaneet, Dr. Giri, Dr. Merikuti, and other dignitaries, those who are registered and attending this program, GRAHESHU ANUGUNEShu. So my duty in this program is just moderate the proceedings. Moderation here means the scientific issues, only that much. Anyway, so this topic, Graheshu Aniguneshu, is having its own relevance for the time. You see, now this is a part of Shoga, which we have taken from Ashtanga Hridaya Sutrasthana first chapter, while describing about the Suhasadhya Lakshanas. Vaghadacharya says that Graheshu Anuguneshu and such things that will be Suhasadhya Lakshanas. Like that it goes. So that we have taken as a quotation for discussion for today. It is relevant that whether grahas are having any influence over us or not. That is a question. It's a big question. And astigas, nastigas, some classifications are there. Some say that it is not there, it is not influencing, and some other says it is having much influence, and we are just instruments, and somebody else is, or the force generated out of these grahas are making us to work like that. So many opinions are there. You see, but as far as Ayurveda is concerned, what I feel is we are controlled by some of the grahas which are there. You see, our months, Ayurvedic months are named out of this presence of this Purna Chandra, that is Paurnami, plus the nakshatra and that day, and that which is which we can see that nakshatra in that day. So if both are coming, we will call it as at that time. So this month, this is Kartika Nakshatra and Paurnami. On the day of Purnima, you can see the Kritika Nakshatra also. So this month is named as Kartika. Like that it goes. So for Nakshatra, Graha, everything is interrelated as far as Ayurveda is concerned. You can see the gravitational force or the galaxy, everything is controlled with its own forces in between them. So likewise, we are also a part and parcel of this universe, so that our activities, our mental activities and physical activities, both will be controlled. It will be controlled by some of these grahas, etc., etc. So it is having a great influence over us. So those things we will be discussing it. So with these words, we will go for our program, and of course, we will discuss in a progressive manner. Okay, thank you so much. Namaste.
Thank you, sir. It's my privilege to invite our resource person, Dr. Vikas Neelakandan sir. He completed his graduation from Vishnu Ayurveda College and post-graduation from Rajiv Gandhi University, and continuously pursuing his knowledge on astrology, Tantra, and Ayurveda. Presently, working as Medical Director of Eeshana Ayurvedashram and Specialist Consultant in Poonthottam Ayurvedashram. We welcome you, sir.
Namaste. Kailasodrishakone Suravidapitade Sphatige Mandave Sanmadangaradipidho Varivarilasitam Sevyamanam Suraukhi Janustham Vamabahum Mrgamapi Padasham Jnanamudram Vahantam Nagodudyoraveshtam Dadatam Rishiganehi Jnanam Eeshana Mile. Am I audible and visible?
Yes, Dr. Vikas, you are audible.
So here I'm very fortunate to be a part of this presentation, which is conducted by Vaidyaratnam Ayurveda College, Kayachikitsa Department. And I believe that just because of the good deeds of my ancestors, I got an opportunity to present about grahas like this. And as our esteemed moderator spoken, the word graha is very confusing. And whenever it is said as like graha, we generally imagine that it is the Navagrahas. But for Ayurveda, most of the time, that is not actually the case, because when Charaka says about grahas and grahabhathas, it is actually about some forces which can be influenced by Navagrahas, but the forces which seizes and creates these symptoms, which can be considered as right now as psychological conditions or psychiatric conditions. So the whole presentation is themed on that, and it is now of course we will discuss about the Navagrahas, because Dr. Gauri Shankar sir, our extremely talented, knowledgeable moderator, has mentioned about the Navagrahas in the beginning itself. So it can be, of course, we can discuss about the Navagrahas further, but right now it is about the grahas as it is mentioned in Ayurveda, and the Graha chikitsa that is explained by Charaka and Vagbhadam. So I hope the PPT is visible.
Yes, it is visible.
Okay, thank you. And with your blessings, I'm actually entering into the world of Ayurvedic Graha, psychiatry and psychology. And as it is clear, the understanding of mind in an Ayurvedic perspective is very vast and very deep. I don't think even at this point, the modern psychology actually reach into a point where it can actually scale the depths of the Ayurvedic science. So this is actually a very lofty attempt to just go through the superficial factors of grahas and graha chikitsa mentioned in Ayurveda, and to align it with the psychiatric or psychological principles of this time. And as I said earlier, it's a superficial attempt. I'm not in any form or scope capable to make a deep dive into that. So just like the great poet Kalidasa said, Titirshu dustaram mohat, utupen asmi sagaram. So just because of the moha, it is actually, we are actually just making this presentation as an udupa, as a boat, and try to cross the big sagara of psychological knowledge and also metaphysical knowledge which Ayurveda possesses. And that is the essence of this small attempt. So with all your blessings, we are beginning here. So concept of Graha chikitsa. So this word actually said, Graha is sometimes very misinterpreted. In the Vedic times, So when we are in the Vedic times, the times of Rig Veda, Yajurveda, and Atharva Veda, that time the word graha actually means some external forces or some new supernatural forces which can actually control, seize, grahana of our mind and intellect and can cause disease. At that time, the Navagrahas, which we now call as the Grahas, they are called as nakshatras, along with the other nakshatras, like just like the sir mentioned, Ashwini, Apabharani, Kartika. Just in that way, with those nakshatras, our 7 grahas were also mentioned. That is why in the Atharva Veda, we can see there are 33 nakshatras, which are 27 nakshatras, and the 26 and nakshatras plus 7 grahas, 33. And in the other way, the Parishishta, it is 34. That means 27 plus 7. Like that, it is actually growing like that. So graha in the Vedic times means graha, what it is meant in Charaka Samhita or Ashtanga Hridaya, Bhuta Pratisheta, as some extra physical or supernatural factors which can afflict our mind and cause different diseases, which we generally called as psychological diseases. So here, when we are actually speaking about the Graha Chikitsa, the title itself said it is the concepts. The concepts of Graha Chikitsa are basically 3 major concepts are there, which is involved with Graha Chikitsa. The 3 major concepts are Graha as the afflictor. Second is Manas, the afflicted. And the third is Unmada, the affliction. So these are the 3 factors which we now go through the presentation. And because of, even though this is about grahas, but in these 3 factors, mind is the factor that is more close to us, and it is also the factor which is inside us, on which we can work a lot. So detailing about the mind first. This is very familiar topic for any Ayurvedic doctor or like Vaidyas. The concept of mind is very familiar. A mind is actually connected with a lot of different things. Mind is actually said as one part which forms the life. Sharir Indriya Satvatma Samyogo Dhari Jivitam. So that Samyoga, it has got Sharira, Indriya, Satwa, and Atma. The Satwa is what we call the mind, which again have 4 factors according to all Vedic sciences. Satwa has got this Manas, Buddhi, Ahankara, and Chitta. So they all create the Satwa, and Satwa is actually one part, one essential part, which actually create the entity called life. Now, when we come to the health, then actually it is like mind is said to be like the definition of health is samadosha, samagnisha, samathatumalakriyah, prasanna atmendriyamana, swastha ityabhidhiyate. So it's like in the definition itself, is there should be prasanna atmendriyamana, and prasannata is a condition where there is no dukkha. Prasade sarva dukkhanam hanirasya upachayade, says Bhagavad Gita. So that dukkha hina avastha of mind is very important, and it is an unavoidable factor for health. And then comes the disease, which is another aspect of Ayurveda. According to the Maharshis, diseases are ragadi rogan satatanushaktan, sheshakaya prasratan sheshan. So every disease is actually originating inside mind as raga, dvesha, or krodha, or lobha, or moha, or mada, or malsarya. And actually in the ending stage, when it is said aulsukya moha aratikrit, aulsukya moha arati, they are actually the signs of asadhya roga. They are also mental or psychological signs. So actually a disease at the beginning is, it is related with mind, and also at the end, it is related with mind. So without a proper understanding of mind, it is difficult to understand diseases in general, and also particularly diseases that is pertaining with the mind. So now in that context comes Bhuta Vidya. Because of this importance of mind, that is the reason why Ayurveda specialized on that, and that Bhuta Vidya become one of the specialities of Ayurveda. Along the other 7, it is one of the major specialities of Ayurveda, because Ayurveda invested a lot of its knowledge and resources in understanding mind and its diseases. Now, Sushruta's definition of Bhuta Vidya. Bhuta Vidya Mama, Deva, Sura, Gandharva, Yaksha, Raksha, Pitru, Pishacha, Maka, Graha, Dipasrishta Chetasam, Shanti Karmam, Baliharanadi, Graho, Pashamanartham. So it's clearly explained, like because of the factors, it can be of Purva Janma, or it can be of this Janma, it can be of influence of some of the Navagrahas, maybe Rahu or maybe Saturn. Some factors are influencing, and these external supernatural forces are seizing us and create the diseases. And Sushruta also says Bhuta Vidya is the part of Ayurveda which explains how to deal with them, how to make someone who is grasta with graha to be healthy again. Now, to understand the concept of grahana, we need to understand a concept of mind in a bit more detailed fashion. And mind is actually envisioned as a dravya. Ghatinyatma manah kalo dishascha dravya sangraha. So because it is considered as a dravya, it's a very important thing in Ayurveda, because that is how Ayurveda is able to explain its gunas, its karmas, and that actually made our understanding of mind much more advanced in any other contemporary or new age sciences, because we consider mind as a dravya and explained it in terms of gunas, karmas, etc. Now the lakshana and guna of mind. Lakshanam manasah jnanasya bhavo bhava evacha. So mind acts as a switch for jnana. So when the mind is on, we actually get the jnana. When the mind is off, we are not actually getting the jnana, even though the indriyas are in sannigarsha with the arthas. But then also the pratyaksha jnana is not available if mind is off. So it acts as a switch for jnana to put it on or put it off. And the qualities of mind, anutvam athacha ekatvam, dvau guno manasah smrito. So when we consider these two gunas, manas or mind is anu, and as it is anu, it is very strong because it cannot be divided further. So it actually acts as a charge, or like electricity, or like something as an urja, as an energy. As it is anu, it acts like as an energy. And also the other guna, ekatva, is also important. It is particularly important when we are into dealing with the different factors of psychological cases, because of the ekatva, a person can only have one mind. So when we are dealing with different patterns that is given by the patient, we will be able to understand one pattern that is consistent in all the different psychotic symptoms. So that pattern actually belongs to this mind, because mind, no person can have two minds. Now the karma of mind. Indriyabhigraha karma manasa swasya nigraha uho vicharascha tataparam buddhi pravartate. So just like said, it is switch on and off of indriyas is one of the major karma of manas. And the another more important karma is manasaha swasya nigraha. mind is capable of controlling itself, extinguishing itself, and recreate in a different pattern. So that is the capacity of mind to do the swasya nigraha. Mind can actually, so if there is a very bad thought process that is happening inside a patient's mind, if the sufficient support is achieved, that person can actually extinguish or like cut down that thought process and actually recreate or regenerate another completely different thought process to facilitate the mental health. So mind can actually heal itself. It's a very important point because of the applications in the treatment. Uho vicharascha tataparam buddhi pravartate. Uha is generation of knowledge in a nirvikalpa way, like when an indriya gives a knowledge to mind, that actually belongs to uha. But when mind analyzes it with different factors, when it becomes savikalpaka, that is called as vichara. Now to the position of mind. So generally in Ayurvedic community, the general consensus is like Hridayam Chetana Sthanam Uktam Sushruta Dehinam. And when it comes to Sadhaka Buddhi, Metha, Abhimana Dehi, Abhipretartha Sadhana, Sadhanam, Sadhagam Hridgadam Pitam. So in that way, we can see that Ayurveda always consider Hridaya as the sthan of mind. But here, I'm just trying to give another perspective. This is not a conclusive thing, but just a discussion perspective, because Yoga Vasishta says, Yoga Vasishta is a very important book of Vedanta. It says, Satho Jagati Bhutanam Hridayam Dividham Smradam Upadeyam cha Heyam cha Vibhaguyam Tayo Shrunu. So here the two heart theory, like we in our body, in our system, we have two hearts. Two things, not two hearts, two things which can be called as Hridaya. One is called as Heya, which is our general definition of heart, and the other one is called as Upadeya, which is Savin Matra, that means which is works as signals. So that actually, at a wild interpretation, it can be actually correlated with our nervous system. And it can be also one reason when we say about Manovaha Srotas, it is said Tayoho Moolam Hridayam. So Hridayam is the Mula. That Hridaya can be this Upadaya. It can be, there is no conclusive statement there, it is or it is not, but it can be. So that is a discussion point which we can think later. And mind's position according to Bhela. This is actually a very interesting take Bhela has got here. Shirastal Vandaragadam Sarvendriya Param Manaha. So Manas is an Indriya and it is between Shiras and Talu. A lot of people understand that as between the top and the bottom of the Kapala. So it explains about the whole brain. So there is another explanation given by Bhela when he describes about Alochaka Pitta. Buddhi Vaisheshiko Namayo Bhruor Madhye Shrinkatagastha Susukshman Arthan Grinhadi Grihitam Dhareti Dharitam Pratyubaharadi Atitam Smarati Pratyutpannam Kritva Anagadam Prarthedi. So as we can see, these are all knowledge processes or thought processes. And so this actually, it is said that is situated in Shrinkataka, Bhruor Madhye Shrinkatagastha. So maybe close to the Marma position of Shrinkataka. Here, the connection with Shrinkataka, in our experiences, we have seen a clinical importance for that, because whenever we are actually dealing with Graha Bathas, we can actually see a strong heat that is coming from the Shrinkataka region. And also whenever we are dealing with, we use the Navanita Lepa and to measure how much heat is there on that area. From that, we can actually generally positively infer the progress of the disease. And in the same way, for children, particularly with ADHD system disorders, then for them, actually, if we are doing a good massage over here with some Vata Prashamana or Vata Pitta Prashamana Tailas, we can actually see a great result in their progress. And also, if we are actually doing Tilaka with Chandana and Purana Krita in this area, a bit lower to the Stapani, that actually is, we have seen that as very effective in several cases of Grahabata. Now the gunas and mind, because mind is invariably connected with the trigunas, and Ashtanga Hridaya says Rajas Tamascha Manasaha Docha Dosha Udahradu. And Rajas and Tamas are those doshas which actually deteriorate the mind and which destabilize the mind. Satwa is that guna which actually stabilizes the mind and which actually precipitates good psychological well-being. So Charaka further explains that Satyugam Shauchamastikyam Shuklavatma Ruchirmadi. This is how to check or how to understand whether a mind is actually influenced by Satwa or whether a mind is influenced by Rajas or whether a mind is influenced by Tamas. This is of critical importance in treatment of psychological disorders according to our experience, because if you cannot actually convert the patient into a sattvika lifestyle, the treatment progress is seriously impaired if the patient is not following a sattvic lifestyle. So it is this influence of gunas on mind is of extreme importance. Now, a kind of controversial topic, which is called as personalities according to Ayurveda. And in Ayurveda, Maharshi Charaka says the Sattvas. It is like mental Prakriti, but more in a dynamic state, because Prakriti is almost well-defined and static, but Sattva is more dynamic. If a person is actually really putting the effort, he can actually improve his Sattvas. Why the understanding of Sattva is important? Because sometimes what we understand as a Grahabata generally can be that person's Sattva. It is very difficult to differentiate between a person who is having, say, Asura Sattva and a person who is having the Asura Grahabata, because they are much more closely related in their symptoms. So one of the good ways to deal with that is to take a deep history, and in that deep history we will understand whether this person is from the beginning in this way, or if there is some big changes happened and this person become like this. That history taking is important to differentiate between a Sattva and a Graha. That differentiation is important because particularly in Daiva Vipashraya, something like Uchchadana karmas or like Avahana karmas, they can be very bad for a person if that is his Sattva, not Graha. If it is Graha, it is very good, it will work, it will enhance the whole treatment procedure. But if it is Sattva, then it is very difficult after that process. So it is important to know whether it is Sattva or Graha. And if it is Sattva, it needs psychosupportive approach, like that person doesn't need any treatment per se, but he needs a lot of support in such a way that he can improve his Sattva into a higher one by changing the Guna Prakriti, by changing the Rajastama Prakriti. Now these are the 16 Sattvas. Of them, the top ones are basically Sattvic, and Sattvas like Asura, Rakshasa, Pishacha, Sarpa, Preta, Shatuna, they are basically a bit more Rajasic, and then further is Tamasic. So the criterion which is taken by Charaka for the classification is Shuddha Satwa. If a Satwa is Shuddha, it is called like that because of the Jnanam Shatvat. We can see the element of Jnana in that person, and then we can understand that he belongs to the Sattvika Sattvas or Shuddha Sattvas. Rajasa Sattva, we can actually see the Rosham Shatva, the Rajasa Sattvam Sadosham Akhyadam, Rosham Shatva. So whenever we are making a consultation or an interview, we can see this factor of Rosha in their whole history. And from that, we can actually imagine or understand that it is a Rajasa Sattva. Tamasa Sattvam is Satosham Akhyadam Moham Shatva. It's a bit rare to see Tamasa Sattvas, but they are basically marked by moha or ajnana, or the inability to understand something. It actually a bit go towards the mental retardation spectrum. Now the Brahma Sattva, Arsha Sattva, the qualities. Here we can actually, there is a model in psychology called the Big Five personality model. I am sure somebody of my respected audience are familiar with that. The Big Five model is generally dealing with 5 traits which can actually describe a person's personality. So when we go through the explanation given by Charaka, we can actually perfectly apply the Big Five model into the Sattva model of Ayurveda, and it can actually further can lead to a recognition for that personality classification by Charaka. So Brahma Sattva, we can say that in the Big Five model, if a person is having Brahma Sattva or Arsha Sattva, they will be very high in agreeableness, or they will be very high in conscientiousness, and they will be very high in openness. They will be very lesser in neuroticism, and they will be very generally for Brahma Sattva and Arsha Sattva, they will be introvert. And when it comes to the Indra Sattva and Yamya Sattva, almost these 4 factors remain the same, and they will become more extrovert rather than introvert. And when it becomes Gandharva Sattva and Asura Sattva, they will be very low in agreeableness, they will be very low in openness, and they will be generally very highly extrovert. Particularly Gandharva Sattva people are very highly extrovert, and they will be very much high in their openness, and they will be very comparatively lesser in some factors like agreeableness or something like that. So this actually is one of the way we can understand the sattvas and apply that into our psychological practice whenever we are doing that. And Rakshasa Sattva and Pishacha Sattva are high in neuroticism, and they will be very low in agreeableness, and they will be very Rakshasa Sattva is extrovert and Pishacha Sattva is basically introvert. So they will be confronting Rakshasa Sattva, but Pishacha Sattva will be just avoiding the treatment. So that actually can be seen. And Varuna Sattva is a bit more towards the Sattvic type, so it actually worked well with the definitions of the openness and agreeableness like that. And Sarpa Sattva, this actually, if anybody is for people from Kerala, they actually may have seen this in action, because there are a lot of temple rituals in Kerala which is associated with creating an environment where a person from their default sattva just goes to the Sarpa Sattva and then act like a serpent. I am very sure a lot of people may have seen that in temples. So particularly from Kerala. So, and that actually happens because the change of the environment make that person to alter their sattvas. So Sarpa Sattva will move like a Sarpa, etc. And Preta Sattva is very rare. It is when a person act like a Preta or like some ghost. Now, Shakuna Sattva, Pashu Sattva, this belongs to the Tamasa group, and they basically are very rare to see and also very difficult to respond. And it takes a lot of effort from the Vaidya to improve their sattvas into a Rajasa Sattva at first, because they actually can respond better to the Vaidya. And in Tamas Sattva, it is important that to change it first into Rajasa Sattva and then try to change it into Shuddha Sattva, because Rajas will respond much more better in a situation of Tamas than Sattva. So it's also by the Shraddha. So in Bhagavad Gita, there is a full chapter which explains about the different attributes of the Trigunas. And using that techniques, using the Sattvika Ahara, using the Sattvika Vihara, or using the Rajasa Ahara, we can actually improve a person's Sattva. And in treatment, it is utmost importance to know that whether it is a Sattva or whether it is a Graha. Otherwise, when a person comes with Gandharva Sattva, he will generally be like a Gandharva Graha. But that differentiation is very important. Now coming to our second concept, Unmada. Unmada is actually, it is mostly used as a blanket word in Ayurveda to express all the elements related with mind, particularly when it comes to the after the loss of the jnana of the Bhuta Vidya, and when it comes to the realms of Kayachikitsa, that Unmada term generally explains both the dosha Unmada and also the Graha Unmada. So Unmadam Punar Manobuddhi Samjnat Jnanasmriti Shakti Shira Jeshta Achara Vibhrama Vidyat. So it can be a Mano Vibhrama, can be a Buddhi Vibhrama, it can be a Samjna Vibhrama, anything of that sort can be called as Unmada. Here the term used by Maharshi Chataka is Vibhrama, because there is a normal Brahma which we generally have, because sometimes when we are trying to think something, we may get completely different memories, or when we have, sometimes we will find it difficult to deal with some Shila, which can be said as Shila Brahma. But Vibhrama is actually a bit more serious situation where a person is completely changed into that way, and he or she is not capable to regain the balanced state with any effort. So that is the time which it can be called as an Unmada, and that is the time where the Vaidya need to be enter to the support of the person. Now, classification of Unmada according to Sushruta. So this actually is interesting, because Sushruta says that in the Bhuta Vidya, these 18 factors are the factors to be concluded or like to be understood. One is 8 grahas, and then there is 4 apasmaras, and here it is 6 unmadas. Of this, we are only taken the grahas and unmadas for the purpose of this presentation, because in the realm of Kayachikitsa, they are actually coming under the classification of Unmada. So Charaka says there is 2, Agandu and Nijotha, and again further explain it as Vatika, Petika, Kaphaja, Sannivadika, and Aganduja. Vagpada, on the other hand, says that Unmada, not Graha, Unmada itself is of 6, Vataja, Pittaja, Kaphaja, Sannivadika, Adhija, and Vishaja. So the Samanya Nidana for Unmada. First one is Viruddha Dushta Ashuchi Bhojanani, particularly for Doshonmada and also for Grahanmada, because many of the times we will consider this as only for Doshonmada, but certain anna or certain food, which sometimes is involved with some bali or some nivedya or some other purposes. Generally, when a person eat that, it is seen that his susceptibility towards graha batha is increasing. In doshonmada, it is very clear, like that actually is a major factor for the dosha vaishamya. Pratharshanam, deva guru bijana, that is behavior related causes. These are right now in the realm of psychology considered as a very important factors, because for a person, they generally know what to do and what not to do. And when they do something that is something that they know that they are not supposed to do, it actually creates a factor of guilt. And that guilt will further seen as different lakshanas of Unmada, which actually comes from the root of guilt, which they incurred from this pratharshanam of Deva, Guru, Dvija, etc. Then there is Bhaya Harshavova Manoabhikhad, which is very much the case these times, because there is a lot of anxiety involved and there is a lot of instability involved. There is a lot of issues involved with certainty, and because of that there is a lot of bhaya and there is a lot of excitement, harsha. All newses are bringing either bhaya or harsha for us, and because of these conditions, this shock related unmadas are getting more importance day by day. Then vishamascha cheshta, this actually is more closely related with graha rather than the dosha unmada. Of course, it can be said about dosha unmada in case of vyayama, etc. But in case of graha, particularly if they are doing some activity or moving in some ways in some places, generally that enhances their chance to get a batha by grahas. So this also is a very important nidana in case of Unmada. Now the Samanya Samprapti. For an Alpasatwa person, the Pradushtamala, that means Vata Pitta Kapha, and they actually enter the Hridayam, which is actually Buddhehe Nivasam, and that Hridaya actually is got dushita by the Mala, and then actually affect the manova hasrotas and generally create the moha of the chetas. So it actually is a interesting thing to understand that for this samprati to happen, a person should be alpasatva. That is also the reason why all the dosha vaishamya is not creating unmada. It takes an alpasatva person to get a dosha unmada. And when we are actually able to support a person to become a pravara sattva from an alpa sattva, then the chances for unmada is highly declined. And that is also a part of the, when a person is discharged, it is a must that we need to advise them, we need to give them instructions to convert from alpa sattva to pravara sattva. Otherwise, because the grahas can came again and do the bathas, or like dosha can again enhance and create the unmada. So alpa sattva, that factor is very important whenever we are dealing with unmada. So these are the samanya rupa, which can be seen in different types of unmada. And this is actually also the biggest factor which gives away the signs of a psychological condition, because there will be shunya hridayam, there will be mudha chetas, and another factor which is very important, sukhadi anupapati. So sukha samnyagam arogyam vikaro dukkha evahi. So if a person knows that they are in sukha, they will, that also infer that they are healthy. But here, normally when a person is not feeling sukha, then they actually feel dukkha. But in Unmada, there is certain conditions where the person is neither feeling sukha nor feeling dukkha. That actually is a big risk, because that actually we will not be able to guide the treatment in such a way by asking that person, how are you feeling, or are you more comfortable now? It is very difficult because he actually is not feeling the factor of comfort itself. So this Sukhadi Anupapati is actually when it present as a symptom of Unmada, it's a very tricky symptom which makes the treatment all more difficult. And now to the differences between Dosha Unmada and Graha Unmada. This also is whenever we are doing the practice of Ayurvedic Bhuta Vidya, then this actually is a big factor. But our Maharshis, Acharyas, clearly explained the differences between them. So for Dosha Unmada, the Dosha Vaishamya is present before the Unmada. But for Graha Unmada, first Grahas cease and then create the Vaishamya that is necessary for the Unmada. Dosha Unmada is not particularly connected with dates, but Graha Unmada in that sense, it is very much connected with Jyotisha, because it is much connected with Tithis. There are very specific Tithis, and we can see that in our clinical practice, as explained by Charaka or Vagpada, that the disease is getting a huge boost in those Tithis, and that is the another difference. And in Dosha Unmada, generally we cannot actually see superhuman attributes, but in Graha Unmada, because the Graha is present, this superhuman activities can be easily present. And it is also true in a lot of, sometimes we can see children with some psychological condition, neurodevelopmental condition, generally possess some superhuman abilities which otherwise cannot be explained. That actually is connected with grahas, and that attribute will be clearly seen in a graha condition. And for a Dosha Unmada, with some support from Satwa Vajaya and the Daiva Vyapashtaya Chikitsa, we can actually manage a Dosha Unmada very well with Yukti Vyapashtaya as our main focus. But for grahas, they generally are not that much responsive to Yukti Vyapashtaya Chikitsa alone. And Dosha Unmada, generally, as we seen earlier, it affects Alpasattva. But grahas, they generally not having a regard for a person's sattva. They are considering the karmadi sambandha as explained by Chakravarti. They are also connected with karma, but they are not concerned about sattva. Graha, if the karma suggests so, they can actually inflict harm on a hina sattva person and also a pravara sattva person. So that is the thing. And one more key difference is they are not responsive to Graha Unmada is not responsive to Dosha Upashaya and Anupashaya. For an example, when we are actually getting a Vata Unmada and we are doing Abhyanga, Taila Abhyanga or something for some 3 days, then we can see a marked improvement from in the cases, and we can actually hear that from sometimes the patient or sometimes the people who are associated with him or her, that there is some improvement. But in Graha Unmada, we are doing that Abhyanga. It generally may not be doing anything extra rather than that procedure. So it is actually Dosha Unmada is related with Upashaya and Anupashaya of the dosha. Graha Unmada is not. And another distinguishing factor is for Dosha Unmada, based on the dosha kala, Mayoho Ratri Bhuttanam Deyandyamdhyadiga Kramat, that dosha kala, the Dosha Unmada will have rises and lows, but Grahanmada generally doesn't follow that pattern. Now, just to conclude some details about the dosha Unmada. Vatika Unmada, it is maybe the most common Unmada, and the Lakshanas are clearly explained by Maharshi Charaka. And these Lakshanas are also imitating a lot of Grahanmadas, like laughing, smiling, etc. That actually imitates Gandharva or Yaksha Grahas, and dancing, singing it's also, and moving limbs sometimes imitate Brahmarakshasa Graha. And here the most important is like the degree of Vatika Unmada is so high that a lot of different disorders we can actually treat with the principles of Vatika Unmada. So when we are going towards the chikitsa of Vata Unmada, with the chikitsa of Vata Unmada, we can actually in a good way manage a lot of psychological conditions like adult ADHD, or like Tourette syndrome, where the tics are happening, the limbs are moving uncontrollably. That actually can be well successfully dealt with the principles of Vatika Unmada chikitsa. And it is important to know that if we are not very clear about what method to be followed, then the parampara, or like the traditional wisdom, is to follow the treatment of Vatika Unmada without aggravating pitta. So these are the general medicines used for in our practices for Vatika Unmada. Unmade Vadaje Purvam Snehavanam Visheshavit Kujyada Avada Margetu Sneham Badushodhan. So generally what we are doing is we are doing this Mridushodhanam at first, because it actually is proven very helpful for us to deal with. And then we do the Snehavana. Generally we use Mahalpanjagavya Krita or Mahakalyanaga, but for some people, for some reasons, Mahakalyanaga is sometimes generating Vamana, etc. Like not the procedure Vamana, but the symptom of Vamana. And that because of that, generally we use Mahal Panchagavya in our practices, and do another things like Abhyanga, Tailadhara, etc. And Shirolepa, particularly if we can get the Karaskara Shirolepa, Karaskara Navanita Shirolepa, that actually is really, really seen good in case of Vatika Unmada. And maybe the most efficient thing to treat Vatika Unmada can be Purana Krita. And it is explained by Maharshi Charaka himself. Visheshata Puranam cha Kritam tam paye bhishat Pridoshakham Pavitratvat Visheshat Grahanashana. It is also used generally in every treatment of Graha. So that is the Vatika Unmada. With the treatment of Vatika Unmada, we can treat a lot of different psychological conditions. Now to Pitta Unmada. These are the Lakshanas of Pitta Unmada. It's a bit more, there will be a bit more aggression in Pitta Unmada compared to Vata Unmada. So, and also there is high irritability. So whenever dealing with Pitta Unmada, it is better to give some medicines before the treatment, 1 month or 2 months before, to reduce the state of aggression and to reduce the unwanted consequences of that. And Pitta Unmada is also, it's we can do that well, and it is sometimes connected. Like here I'm suggesting a modern psychological psychiatric condition which actually resembles Pitta Unmada, not maybe with all the symptoms, but with the therapeutic approach. So in these conditions, if we are actually doing the therapeutic approach of Pitta Unmada, in our experiences, we are getting great result with this diagnosis. This is a schizoaffective disorder. So for an understanding, it is not schizophrenia. it's another disorder, schizoaffective disorder, which actually can be said as a mixture or like a child between like schizophrenia and bipolar disorder. So there will be schizo symptoms, and there will also be mood symptoms of the bipolar. So when we are approaching it in the lines of Pitta Janmada, we can actually we experience ourselves getting great results. But there are also some important factors in when we are attempting the Pitta Janmada chikitsa, because generally Pitta Janmada will be already diagnosed, and the person may be taking a lot of mood stabilizers, something like valproic acid or like lithium tablets. So when we are doing the treatment, it is important to know about these medications, because valproic acid is generally liver toxic. So if a person is taking that for a long time, generally their liver will be less functional, and because of that less functional state, sometimes it will be difficult to do the whole Snehavana thing and to go through that whole procedure. It sometimes can overload the system, and it can be having dire consequences. And in lithium taking patients, it is very important that we are not sometimes doing our virechana or vamana, because for a lithium for a person who is taking lithium tablets, it is very dangerous to get into a state of dehydration. So when we are actually doing the virechana or vamana, there is a high chance that states of dehydration can be there, and in that state it can actually lead to severe toxicity. So when we are dealing with patients who are taking those medications, it will be advisable to take a good care. Now, these are the general treatment we are following in the Pitta Janmada. So we basically do the virechana. Virechana is, in our experience, the best treatment for generally all mothers. And with that, along with that, we are also doing this Kshiradhara, etc., to reduce the pitta. And if a person is having Pitta Janmada and he or she is very aggressive, one treatment which always gave us great result is called Jaladhara. So sometimes we do that with normal water. Sometimes we'll do that with Ashtagandha Jala. And it actually is, we are sitting a person and doing the Abhisheka from 4 sides with Jala. And if that person is very aggressive or very irritable, we have seen great results when we work with that aspect, that treatment. Now to the Kapha Janmada. Kapha Janmada generally is having these symptoms, and it is a bit more riskier sometimes, because Kapha Janmada generally behave like major depressive disorder, and we can actually get, even the similarities will be there in the symptoms, and also we can actually get good results with dealing with major depressive disorder as Kapha Janmada, if the lakshanas are present. There can be sometimes the lakshanas are not present, but if the lakshanas are present, if you are dealing with that, it can be of great results. And in the treatment, the only thing sometimes we need to be careful is that our medicines are very powerful. All the medicines from the Samhitas are very, very powerful. And when we are dealing with a patient or a person who is taking SSRIs or any SNRIs or something like that, generally there will be a collision period where these two medicines actually is acting together on the whole serotonin or dopamine networks. So that actually sometimes can create situations like the serotonin syndrome, like that. So it is important to take good care of that when we are actually dealing with the major depressive disorder as a Kapha Janmada. So these are the things which we are doing there, and we mostly got good results in major depressive disorder, and that and also it's a very important thing to look for when we are treating with that, because these SSRIs or SNRIs, they have a strong withdrawal symptoms. So when we are actually, if we actually cut down the medicine in a very high pace, it can actually create a lot of unwanted symptoms. And also, if you are also changing the dose, it is good to be careful, because they actually create a lot of mood variance and sometimes higher state of mania when between the doses. So we use this. Vamana is very good in Kabhajonmada. Many of the times we may not get the right yoga of Vamana because of the person's inability to focus onto that. But still, in our experiences, Vamana has given great results on that. And along with Virechana and Gomutra Dhara is found very helpful in this whole process. And that is the Kabhajonmada. Now the Adhijonmada. And Adhijonmada is much, it is explained by Vagbhara as something that is happening after a shock. And this is where the dosha and Shruta chikitsa with Satwa chikitsa sometimes is most useful in the Adhijonmada. And a new age disease, or like a new named disease that is closer to Adhijonmada, can be PTSD, like post-traumatic stress disorder. There is similarities in the symptoms, and also there is a great success when we are dealing with PTSD in the lines of Adhijonmada. So generally, when we are doing that, it is we are using the faculties of the Sattvavajaya to deal with the PTSD, and we have found good result when we are using Sattvavajaya to deal with the PTSD. So that is Adhijonmada. Vishajonmada, it can be substance abuse, but generally our Maharshis instructs us not to attempt the chikitsa for the Vishajonmada. And the Lakshanas are like this, but I think that it is more connected with substance abuse than any other thing. Now the Atatva Abhinivesha. Atatva Abhinivesha generally is Ayurvedic community consider it as sometimes as delusion or something. But when we are looking from a psychological point of view, it is because of all the dosha prabhavana things, Marinahara, Vegadharana, Atisayana, etc. And the total word is Atatva Abhinivesha. Abhinivesha means extreme interest in something that is Atatva, something that is not good or not real. So what we consider Atatva Abhinivesha is more close to the addiction syndromes, not just like the addictions, for example, addiction towards gaming, because that person generally feel a lot of physical problems, like problems with eye, problems with headache, problems with concentration, but still they actually try to move further and further with that same habit in certain conditions, like gaming addiction. So it is like Vishama Buddhi in Nitya and Anitya. So they doesn't know which is Nitya and which is Anitya. And also Vishama Buddhi in Hita and Ahita. So Atatva Abhinivesha is one condition where the full process of Panchakarma, along with some Rasayana Seva, is found important and successful. Now to the Gadodvega. Gadodvega is like the anxiety problem, like Udvega means anxiety, Gada means disease. So when anxiety becomes a disease, actually it can be called as Gadodvega. And the treatment is, of course, Deepanam Pajanam Yasyat Yat Vayor and Romanam. So maintaining the Deepana and Pachana, we are doing the treatment for Vata Unmada or Vata Anulomana chikitsa, then generally it is found really well for Gadodvega. And this can be actually correlated by symptoms and also by therapeutic result to generalized anxiety disorder or GAD. So it is one of the major disorders. It sees from the years from 2010 to 2020, the prevalence of this generalized anxiety disorder has been increased by 4,000%, and more people are getting anxiety disorders for a long period. So at that time is the importance of our Gadodvega treatment to deal with that and to take them out from the anxiety state, because the modern psychiatric, even psychological treatments for anxiety disorders are much complicated, and most of the drugs used for anxiety disorders are having strong addiction tendencies. So our treatment can be so useful in such situations. Now to the Tatwanmada. Tatwanmada is what we can say as a panic attack or something like that, where there is a nervous breakdown and people are experiencing different symptoms. So in our practice, we found Saraswata Churma to be very helpful in Tatwanmada. And also one thuba which we found is Nimpapatra Jadamam Siddhuba, which generally if a person, generally for people who are having panic attack, they actually can say that it is coming. So when at that time, if we can do this dhuvana, or then it is proven that in our experience to reduce the chances of a panic attack. Now towards our third concept, Graha. The Nirukti is Grinhati Gati Visheshani iti Graha. So Graha is something that actually can interfere with the Gati inside us. So the Gati inside us is generally controlled by two factors. One is mind and another one is prana. So they are actually mutually connected, and they actually control the Gati inside us. That is why Mano Java, that Manas is that factor which can actually maintain and control the Gati, the way the system is functioning. So when grahas afflict that, they actually take the control by force. The knowledge of graha was very early available for Indians, and in the Yajurveda itself, it is said that Ya unmadaye tasmai hodavya gandharva sarasova edam unmadayanti. It is in the Krishna Yajurveda. It is said that there are grahas called Gandharvas or Apsarasas, and they actually are the factors which creating the Unmada. So they are the Unmada generating forces. It is in the Krishna Yajurveda. By any conventional calculation, that knowledge is at least 5,000 years old. And Ayurveda actually developed further on that knowledge of graha and found different situations which can be ascribed to the batha of graha. What grahas do is grahane. They actually cut the light from the mind, and mind become devoid of light, and that actually creates different psychological symptoms. Now the graha bathas. So we are saying that there are different graha, like Deva Graha is there, Asura Graha is there, like that. But here the interesting factor is why something is called as Deva Graha, why something is called as Gandharva Graha. So Vagbhara says, Bhutasya Rupa Prakriti Bhasha Gatyati Cheshtidaihi Yasya Anukaram Kurude Tena Avishtam Tamadishet. So some forces, external forces, which is generally called in any other science as Batha. For example, Mandravada call it as Batha. That Bathas are inflicting a person, and then that person shows behavior similar to a Deva or similar to a Gandharva. So then it is called that that person is afflicted by that Graha. So in nowadays terms, if a Graha is afflicting a person and that person is behaving like a robot, then maybe we can call it as the robot graha. And that is also the reason why Vagbhara says that the number of grahas are unlimited. Like there are a lot of forces that is in the time-space continuum which can actually alter our energy system and can cause the graha bathas. So now the types. So Charaka says Deva Graha, Rishi Graha, Vidra Graha, etc. Sushruta also follows the same pattern, but some changes in the nomenclature is there. The Deva Graha, Daitya Graha, etc. And Vagbhara says a lot about a lot more grahas compared to the to Sushruta or like Charaka. It's also a very interesting factor because as the Samhita time is increased, like in the ancient Samhitas, the number of grahas are limited. But as the time progress, as the yuga progress, and as the Satwa capacities of the human being is diminishes, we can see more and more grahas coming out. This is a discussion point, why this much difference between the measures of the Samhitas. So now the Samanya Nidana for Graha Batha. Tasya cha heduhu prajnaparatha eva idi Bhagavan Punarvasuratraya. So whatever the
Can continue, Dr. Vikas.
okay, whatever can be the affliction, it can be of Deva, it can be of Gandharva or Asura, but they cannot actually do anything on us if we are not having done Prajnavrata in this birth or the previous birth. Naiva Deva, na Gandharva, na Pishacha, na Rakshasa, na Janye Swayam Aklishtam, Upaklishnanti Manavam. Here, the Upaklesha means Upaghada by the Rajas and Tamas. So if you are not creating a circumstance by doing Prajnaparatha, even though the grahas are there, they are all around us, those forces are there, but they are not able to infect us or afflict us and create a dosha. That is also the reason why Vagbhara says Graha Chidra Praharina. So for them to do some harm, there always need to be some chidra. Chidra means some lapses in our lifestyle or achara rasayana that allow them to attack us and to take control of us. So these are the Samanya Swarupa of Graha Batha. We can see this all in different grahas. And these are, even this time, we are actually seeing this. So these are the Samanya Swarupa of Graha Batha. Now, directly going towards, when we are going towards the Graha, Deva Graha Batha is not so very common, but it's also very rare to get the chance to treat Deva Graha Batha, because in our society, in our culture, they will become what we can say god men or something like that, because they have all these attributes like face like a blooming lotus and knowledge of past and future. So they generally immediately will be crowned as somebody of greatest siddhis, and then they will go in that pattern till the graha actually go away from this person. So Deva Graha Batha is generally, in our experience, rare to get and rare to deal also. And so the next one is Daitya Graha Batha or Asura Graha Batha. These are the symptoms of Asura Graha Batha, and it is more connected with what we can say as in psychology, there is a cluster of diseases called personality disorders, and Asura Graha Bathas are those which can be easily correlated with antisocial personality disorder. So most of the time they generally ends in jails, and it is also difficult to get them. Even in Devagraha Batha, we can make a small correlation with OCD in certain lakshanas, not but all lakshanas. So when we go to the Gandharva Graha Batha, this is actually very much seen, and we also get a lot of chance to treat Gandharva Graha Bathas. They are like more of a habit of doing whatever they please to do, and we can see this interest in music and interest in dance in a very high level, and they are always highly extrovert. They are always interact with different people, and we can see the signs of narcissistic personality disorder. Narcissistic personality disorder is sometimes we can, in the lakshanas, we can correlate with that. It's not like that correlation is necessary, but in the lakshanas we can do that correlation. These are the lakshanas of Gandharva Graha Batha. And Yaksha Graha Batha is also almost similar to Gandharva Graha Batha, but there will be a lot more drama than Gandharva Graha Batha. There will be a lot of different behaviors which we consider as highly dramatic when it is with the Yaksha Graha Batha. But also they are very incooperative. They doesn't trust, or they doesn't have a respect towards Vaidya, and generally they will never cooperate as such with the chikitsa. And also the next one is Brahmarakshasa Graha Batha. In our Kerala environment, this one is actually one of the most which we are seeing, the Brahmarakshasa Graha Batha. And there will be all this also is sometimes similar with narcissistic personality disorder or borderline personality disorder, and particularly with borderline personality disorder. And there is a very high chance of self-injury. There is very low chance of inflicting injury to another person, but there is a very high chance of getting injured themselves. Sometimes for the reasons of attention, sometimes for the reasons of fear of abandonment. They also do all these kind of activities, and they are also very incooperative in treatment, because they really don't like any of the treatment procedure, whether it can be Yukti Vipashraya or Stoja or Deva Vipashraya. Now to the Pitru and Preta Graha Bathas. These are commonly seen, and these are different. What we can actually imagine is psychotic syndromes or schizotypal personality disorders. We will see all these lakshanas. And Rakshasa Graha Bathas. And Rakshasa Graha Batha is a very serious Graha Batha, because we see them a lot, and also they will be very aggressive, they will be very ferocious, and generally they can attack themselves or they can attack others. So it is always a big issue to deal with the Rakshasa Graha Bathas. So it is very important to do the Daiva Vipashraya chikitsa first, because once we actually do the Daiva Vipashraya and get a control of the disease, it is easy to treat with other systems. Now the Pishacha Graha Batha. Pishacha Graha Batha is what can be correlated as this bipolar syndrome, bipolar 1 and 2, bipolar syndrome, because Pishacha Graha Bathas, sometimes they will be very showing symptoms of one nature, and sometimes they will show symptoms of completely other nature. Sometimes they will just go into the room, lock it, and sit like that for 2 or 3 days. And sometimes they actually go out and travel for 1 or 2 days before sometimes coming back and sometimes not coming back. So Pishacha Graha Batha is sometimes maybe the most difficult to treat in Graha Bathas in our experience. And also Vagbada says that Pishacha Graha Batha, it is to be confronted directly and to be dealt with so severe force, so that we can actually get a better out of that. That is Pishacha Graha Batha. Now the Sapagraha Batha, it is very common, and we will see just like they behave like a snake. And Kushmanda Graha Batha, it is explained by Vagbhada, Khagmurda, Kushmanda, Maugirana, etc. But it is not that much easily seen in the practice. And Rishi Graha Batha, on the other side, even though it is not explained that much, it is very much seen in people. They speak different language. It is actually very much seen in the practice, because they may be a Malayali and they will speak something like German or something like some other different language just without any training. And once the graha is done ucharana, they will also forget that they have that, they will forget that language, and also they will forget that they have spoken that. So that is also a commonly available graha batha, is Rishi graha batha. And the tithis. So when dealing with grahas, both Chalaka and Vagbhada explains the importance of tithis. Tithis, just like said at first by our esteemed moderator, it is very important when we are dealing with the grahas. So we will see the increase of disease in these tithis, and the opposite tithis of each and every of these tithis, we will see some decrease of the disease. So when we examine why actually it happens, the reason is somewhat connected with Loka Purusha Siddhanta, because in Purusha, what exactly is mental state, that exactly is tithi in the Loka. Because for example, Paurnami is when moon is farthest from sun. Moon is the most distant from sun. That is the tithi Paurnami. So the tithis are measured by sun and moon, which is Tatashtatma Prabhavo Dimani, Athamano Matarashi Tarashmi. So they actually are the Atma and mind. So based on the state of Atma and mind in the Loka, that is also the reason why such peculiar tithis have been seen in different grahas, because they actually found that state of Atma and mind more convenient for grahana. That is the reason why these appear in different specific tithis. And now to the Sadhya Sadhyata. Sadhya Sadhyata is not exactly mentioned like that, but still it is very evident, because graha generally affect a person. The reason for graha batha is three: himsa, ratyarchana, kamsha, graha grahana karanam. And in all the cases, if the reason is himsa, it is very difficult to remove that graha. Even if you are using the Yoga-Pashraya, it is a bit difficult to remove that graha. But if it is for the Ratikama or Archana Kama, then it is more easier. And among them, Archana Kama is more Sukha Sadhya, Ratikama is more Pricha Sadhya, and Himsa Kama is Asadhya. That is also one of the reasons when Vagbhada says Bhodam Jayed Ahimsechu. So if it is Himsechu, it is very difficult to do the Jaya. But if it is Ahimsechu, then it is easier for us to treat. And also this Asadhya Graha Lakshana explained by Vagbhada. Kumara Vundanivadam Nagna Mukha Murtajam Aswasthamanasam Dairghaligam Sagraham Tejit. So generally, why the Aswasthamanasa is because, as said earlier, in the tithis where the graha got afflicted, the opposite tithis, generally they will feel like a swasthya. The mind will come to some point of rest. And if that is not happening, if there is no swasthata at all, then it is a sign that graha is almost difficult or impossible to remove. Now the Samanya Chikitsa. Tayo sadhanani mandraush manimangala vilyubhara homa niyama vrata prayaschittopavasa swasthena pranipadagamanadini. So these are the things which we know. Basically, they belongs to the class of Daiva Vipashraya mainly, and then Satwa Vijaya, and then Yukti Vipashraya. Why Daiva Vipashraya is important? Because people sometimes bring their beliefs to the whole Daiva Vipashraya stuff. But why it is important? It is explained by Chakrabani, Acharya Chakrapani, when it is said first about Daiva Vipashraya. So the question is, why Daiva Vipashraya is mentioned first? Sometimes the answer is interesting, because Sadhyo Akleshena cha Vyadhi Prashmanat. Daiva Vipashraya is important because it allows us to do the Vyadhi Prashmana in a sadhya, in a fast, swift, and aklesha, without any or much complications. So this may be true in all diseases, but in psychological diseases or psychiatric diseases, it is very, very important, because with the Vipassana we can actually reduce the klesha of the treatment many folds, and also the results will be very, very fast, so that it allow the person to trust the treatment more. So when we do the Daiva Vipassana first, generally there will be a swift reduction in the symptoms, and that makes the trust factor a patient feels to the Vaidya, or a relative of the patient feel to the Vaidya. That trust factor will enhance when that person is first gone through the Daiva Vipassana. That actually will help further in whenever we are doing the Yukti Vipassana and also the Satwa Vijaya also. Now, this is actually from our experience a treatment plan for grahas, like the Yukti Vipassana treatment plan for grahas. So for Gandharva Graha, Khagurada Graha, from the symptoms, we can do that Vatonmada Chikitsa. Gandharva Graha is very good to do Vatonmada Chikitsa. And for Yaksha Graha, we need to do Vatonmada Chikitsa with some associated Pitonmada Chikitsa. For Asura Graha, Deva Graha, Maugarana Graha, if Asura Graha we obtained, sometimes it is obtainable, then Pitonmada Chikitsa is very, very efficient on that. And Pitra Graha, we generally obtain that. The Vatagaphanmada Chikitsa is very good. For Pishacha Graha, it is Sannipadi Vanmada. Sannipadi Vanmada is very difficult to treat. So in the same way, Pishacha Graha is also very difficult to treat. Now coming to the mantras. So it said that the one mantra which is for Grahabadha is Eeshwaram Dwadasha Bhujam Natham Aryavalokitam. So just by that, Vakpada is inferring to a mantra which is called as the Mahamrityunjaya mantra, because that is this is actually also the part of the dhyana of the Mahamrityunjaya mantra. So that mantra is particularly efficient when we are dealing with the Grahanmadas and even in Doshanmadas. And also Mahapanchakshari mantra, it is also very efficient. And Shaktivanchakshari mantra is also very, we have seen good results with that. And then all other mantras are particularly the lower three mantras, they are more suitable in Graha, particularly if the Graha is very aggressive, then it's Mahavidya or Turita or Mahishamardhini mantras were found, in our experience, found beneficial. Now the belly, Ashtanga Hridaya details about how to do belly for the Grahabadha. So in which place and in which with what dravyas, it is so important. And we have seen good results when we are doing the belly in the prescribed format of Ashtanga Hridaya, and also in different sciences of like different texts of Mantravada, the belly is explained more detailed, and it is also found beneficial. Belly is generally found beneficial only for grahas, not for the Doshanmada. And money is Ratna or Yantra, which we can say the stones, particularly yellow topaz, blue sapphire, and ruby, they are found useful, particularly in the guna case, like if you need to enhance Sattva, that yellow topaz is found beneficial. If you want to enhance a bit rajas, then ruby is found beneficial. If you want to enhance a bit tamas, just to counter the rajas, then blue sapphire is found beneficial. It can be done dharana, and also generally what we do is that we put it in water and give that water to drink further. So, and also the yantras, even written in the metal sheets, like yantras like this, when they are written in a metal sheet and wore by the person, it is seen very beneficial for the Graha Gathas. And the homas, Charaga explains, Rudrasya Pramadhana Magana Loke Charantiye, Tesham Puja Jagurvana Unmade Pramchade. So this itself is indicator of one more homa which we do a lot in Graha Batha, which is called as Akhora Homa and Shulini Homa and Pratingara. These are the Pramadhas. So Akhora, Shulini, and Pratingara is generally considered as the Pramadhas, and Homa for the Pramadha basically is found useful in the Devi Viprashraya approach. Now, certain Aushathas which we found very beneficial in Grahas along with what we otherwise do as Yukti Viprashraya. So Vachahinguleshuna, Prayoga. These are called Prayogas. Certain Prayogas are from traditional wisdom, certain Prayogas from Puranas, etc. So one which we found beneficial in Unmada and also in Graha very much is Panchagavyapana. Daily administration of Panchagavya is found beneficial. And Apamarga Dhuma. This also, like if we are doing the dhupana in the room with Apamarga, and also Dhumapana with Apamarga Dhuma is found beneficial, particularly in grahas like Brahmarakshasa, etc. And Kadali Bhalaleva, this is a traditional thing where we grind the Kadali Bhala and use that with some other things like Navanita or something to do the Lebana. Particularly, this is found beneficial in certain grahas where there is some impairment in smell, in body odor. Because for some grahas, particularly Pishacha grahas or like Brahmarakshasa graha, there can be a very high chance of the person having foul odor from body, and it is also very stressful for the patient. So in such conditions, it is found very beneficial. Now to Satwa Vajaya. Satwa Vajaya, Punarahidebhyo Arthebhyo Manonigraha. So arthas are, as we seen earlier, Chintyam Vicharyam Uhyamcha Dhyayam Sankalpyam. So to block mind from these arthas in such a way that it is not hina, there is no hina yoga, there is no mithya yoga, and there is no ati yoga, is what Satwa Vajaya means. So Chintya is actually Acharya Chakravani explains Chintya as kartavyata, akartavyata. So Chintya is that artha where the mind decides whether to go for that thought or not go for that thought. In psychological practice or Ayurvedic psychological practice, at least, the importance here is like this Chintya is what make conditions like OCD, obsessive compulsive disorder, because a thought process is coming which is called as obsession, and then mind cannot actually block that obsession, and then it results in an action which is called as the compulsion. So this stage of Chintya, the Hina Mithyadi or yogas of Chintya generally results in conditions like OCD. And Vicharya is the Upapatti and Upapatti. So after some information is coming, mind is actually thinking that whether it knows that or not knows that. And when an impairment comes here, that is when the delusions happens, like the paranoid personality disorder that happens at this level, because mind is strongly think that it knows that, even though it doesn't knows that. And then there is Uhya. Uhya is like deduction, like Yukti, the prayoga of logic. after logic is used to understand an information, mind sometimes can reach into very different conclusions than that is true. So this actually results in a lot of personality disorders and also a lot of mood disorders, because mind detect that this is this when it is not that. So reduction from that actually is helpful in that way. Now, Dhyaya is the Bhavana Vijnanam. So it is the imaginary world. This is actually the territory of schizophrenia, etc., where the person is completely in a different world, which is with no connection towards reality. This is very much seen in schizophrenia, and also this is very much seen in dissociative identity disorder, and which is sometimes called as the multiple personality disorders. That this dhyaya can be very much seen, and also sankalpya can be interpreted in that level, because sankalpya also is like this is this or this is that, and when that sankalpa become wrong, that actually will generate in a lot of stress for the buddhi and generate different conditions. Now the dimensions of Sattva. So manaso jnana vijnana dhairya smriti samadhi. Acharya Chakravarti explains that as jnanam is atma jnanam. So these are the ways how Sattva helps in the prevention of hina mithya and adi yoga. Jnanam is atma jnanam, which is much similar to what we can say as the ACT therapy. Like in psychology, there's a therapy called acceptance and commitment therapy. It is moves in this line where the person is contemplating and developing more and more knowledge about Atma, and that prevents the further deterioration. Vijnanam is Shastra Jnanam. This is actually the realm of cognitive behavioral therapy, where the person is consulting with another psychologist and deals with different delusions, different moods, different compulsions in a way that the science is coming there, different techniques are coming there to give a right direction. And dhairya anunnati chetasa. This is like more like the ERP, which is used for treatment of OCD, like exposure response prevention. Like we are exposing the patient towards the triggers of the disease or the obsessions of the disease, and then actually generating anunnati chetasa to make a state where the chetas is not getting anunnati or excitement or like a shock by that stimuli. So that is the level of dhairya. Smriti is smriti anubhuta artha smaranam. This is the realm of what we can say mindfulness, which is coming a lot more popular these days. That is the level of smriti where we are actually putting our memory, our feeling of experience into each and every facets when we are doing something, so that it actually makes mind more calm. So that is actually the level of smriti. And samadhi is vishayebhyo nivritya atmani manasa niyamanam, because samadhi is there is no actual equivalent for samadhi to this point in the psychological realm. Samadhi is something which is the deepest state of Sattva, where a person is trained to achieve the state of samadhi, where the mind is resting on Atma. It is done by dhyanas, etc., etc. But that samadhi, when it is attained, because as mind is a chitta vritti, when it comes back to Atma, that chitta vritti is just get relaxed, and the person attain the state which is called as yoga chitta vritti nirodha. That state, that is the full scale dimensions of Sattva chikitsa. Now certain techniques which is instructed by Maharshis for Sattva, like these are very correct with their name, like Ashwasanam, Santwanam, Vismapanam, Trasanam, like shocking psychological shocks. And Charaka also give a great idea when Maharshi Charaka says pratidvando upayoga, like when somebody is hurt with one emotion, just give the opposite emotions to take mind out from that. Such techniques are there detailed in Ayurvedic texts, which we can use for Satwa Vijaya. Now the suitable vihara, Trivarga Anyakshanam, Tadvidya Seva, Atmadi Vijnanam. These are important because once a person is coming out from mother, these will actually help to deal with prevention of a further occurrence. So now the Hita Ahara, Nivrittamishamadyoyo Hitashi Prayadashuchi. So this is Amisha, like it is very much seen in our practice. If a person is using Amisha or Madhya along with the treatment is almost in a very high level. Inefficiency is there for the treatment. And there is a traditional wisdom which supports even, which prohibits even the use of arishtas in certain Unmadas, because that also sometimes can be classified as Madhya. So that is why we give the Saraswata Churna instead of Saraswata Arishta in certain cases. And this aharas, which generally, and what we are in our experience, what we found is Kushmanda is found to be very helpful as a food item for the treatment of Unmada. So is Mutka, and certain things like Masha, etc. has found generally they deteriorate the condition of the patient. So these are the Hitahara for Unmada. Now the Unmada Mukti Lakshana. So that is very common. Indriyartha Prasada, Buddhi Prasada, Manasa Prasada, and Dhatu Prakritistasana. That means the doshas should come to their prakritis. And these, when we see these lakshanas, then that is the time to give the patient advice about hitahara and hitavihara and further preventing such a psychological episode. Now, these are three cases which we, like just an history of three cases which we treated in our place using the principles of Graha and Unmada Chikitsa. This person, that is Kabhaj Unmada, and we got a great result with that using the prescribed treatment procedures mentioned in the Samhitas. Now, because of the time, I'm not explaining them. And this is also a very big case because this lady actually heard her father committing suicide through phone because the father called her and just shot himself. So this was such a severe case at that time because the Brahma Rakshasa Grahabadha is never easy to manage because there is no cooperation at first. So after the stage, like when we do the Devya at first, then generally the chances of cooperation increases, and then we are able to conclude that in a good way. And this is what we can say like Gandharva Grahabadha, which is most correlated with, in this circumstance, OCD, because this lady has gotten compulsion to take a bath every time she is in some ashuchi environment, and that actually impaired her work because she was working in a restaurant, which is not sometimes possible to do complete cleanliness, and she actually got great results with this method. So there are a lot of cases where we are not finding such success, but just for the example, we've taken the cases, some cases where we have found good results, so that it can be just a outline for the approach. Now, the discussion part. So it is something we have already said about the increase of grahas from Sushruta to Charaka to Vagbhada. That may be because the state of mind is getting deteriorated because man is improving in such an accelerated pace through the time-space continuum, and it is creating a lot of stability issues which generally affect the mind first. And right now, if you are imagining, there can be a lot more Graha Badhas compared to that. And next one is like the 16 Satwas. Satwas and 16 type of personalities proposed by Myers and Briggs. So if anybody actually is familiar with the personality type, Myers and Briggs has got this 16 types where a person is categorized as like a leader, or like a dreamer, or like a mastermind, such like that. And it is something which we can further improve to connect the Sattvas and with this thing, and to evaluate if there is any connection. And finally, the Graheshu Anuguneshu. And of course, the Graha in the area where it is said as Graheshu Anuguneshu Ekadosha Margo Navasukham, there the Grahas are mentioned as the Navagrahas, because in the commentary of Hindu Hemadri and everyone, they actually explain it as the Surya the Navagrahas. So Navagrahas, they are also so important for health, because it is without, even if all the previous factors are satisfied, just by themselves, Graha can actually make a Sukhasadhya Vyadhi into Krichasadhya, or Krichasadhya into Asadhya. Particularly that is more seen with Grahas like Tikshna Grahas, which are like Saturn, Mars, and Rahu and Ketu. They actually create a lot more diseases than other grahas. And also there is a very strong connection in Bhaladevika. It is said that Pittam Vatayutam Karodi Dinagat, Pittam hi Pittam Vatayutam Karodi Dinagat, Pittam hi Bhumyatmaja. That means Surya is creating Pitta and Vata, Puja is creating Pitta only. Like that, it is explained that the doshas and the Graha connection is explained. And also when it comes to the astrological chart, we have the 6th house, which is more related with disease, and the 8th house, which is more or less related with the death, or otherwise the conclusion of disease. And if there is Papa Grahas, if there is Saturn in the 6th, or if there is Rahu in the 8th, that generally indicates troublesome disease situations, which can actually get worse even if we are doing all the part of Ayurveda very well. But because the Grahas generally belongs to another science, as it is on another Adhikarana, this actually why it is not too much mentioned in this whole thing. Now, coming to the concluding remarks, there are a lot of new age challenges which are increasing the prevalence of psychopathologies. Ayurveda have some time-tested solutions to offer. The depths of the Ayurvedic psychiatry and psychotherapy still remain unexplored. And a concrete approach on mental wellness by Ayurvedic community will be a great boon to the whole humanity at these destabilizing circumstances. So with that, I'm concluding the presentation, and I'm very thankful for all the people who helped me in this presentation, Dr. Ravindranath, Dr. Mridul, Mr. Jishnu, etc., and a lot of others. And I cannot actually show my gratitude, how indebted I am to them. And I am also very thankful to all the listeners for your presence and patience. So, namaste.
Thank you, sir, for this remarkable presentation. Let me invite Dr. P. Gaurishankar sir to moderate the session.
Hello. Hello. Can you hear me?
Yes, sir. Yes, sir.
Okay. So nice presentation with vast knowledge. The depth of knowledge has come out of you, connecting the Ashtanga Yoga Shastra, Graha Shastra, and of course the Tantra also, and of course some parts we may be having a missing of a mantra also. That is, of course, those are there. Well, of course, you are so great man dealing with the Atmiya portions of the science. It was so nice. So let us have discussion or experience sharing or any special questions like that. We will go for that. Before that, I mean, as a starting point, let me have a clear-cut idea about. It says that Achara Vipramsha. Achara Vipramsha is a causative factor for Unmada. Of course, as per Charaka Samhita. So, what are the acharas which we essentially do? We should essentially do. Of course, preferably and if needed, though such acharas are there, but essential acharas which we have to consider in day-to-day life. Please explain those things.
So, thank you, sir. And the essential acharas, like achara is actually not a static idea for Indians, at least. Achara is that which actually changes by time, because Shastra is something that stands for knowledge, and Achara is actually updated or upgraded based on time and space every time by the acharyas. That is also the definition of acharya, is ajinoti hi shastrarthan acharya sthavayatipi swayam acharate tasmat acharya iti kathyate. And the essential acharyas are those acharyas which is actually specified by the great acharyas of that time to follow. But in a general sense, to answer the question, the biggest wrong thing a person can do is pratnyaparatha. So to avoid pratnyaparatha in every step of achara can be said as the one most important thing related with achara. That is also why the process which actually avoid all the pratnyaparathas is also called as achara rasayana, because it acts as a rasayana. And here also it is in Unmada, Pratharshanam Deva Guru Dvijanam. Deva is actually like higher people, and Dvija is actually one who actually knows the Shastras, and Guru is our personal guides. And even if we are not able to follow any other thing, just to follow the steps that is prescribed by the Guru and the Dvija and the Vaidya in that sense, is what can be said as one set of acharas which are helpful to maintain our sanity in this insane world.
Hello. Yes. Hello.
Some questions in the chat box.
Yes. Let us discuss the questions.
Yeah.
Hello.
Yes, sir.
Yes.
So I'm seeing these questions in the chat, and I will try.
Dr. Vikas.
Yes.
I think the moderator will read the questions.
Sure. Thank you, sir. Thank you.
Sorry, not moderator. Dr. Subarya, can you read the questions?
Yes, sir.
Okay.
The first question: is there any hereditary involvement in Graha?
If there is if the question is there any hereditary involvement in Graha Bathas, it generally is unseen. But if the question is there any hereditary involvement in Unmada, of course we can see that a lot, because the Sattva is something which we derive from our parampara, and that parampara is which gives us that Sattva. So if there is any episodes, or if there is any history of weak Sattva in the parampara, definitely that will be shown, and that will actually can be seen as Unmada in or the tendency to go to Unmada in the further generations. But for Grahas are Chidra Praharana. So even if we have say somebody in our family line who is having some Unmada with Graha, but if we are maintaining ourselves well and we are not giving any Chidra, Grahas will never get a chance to act on us. So there is no hereditary involvement in Graha Batha, but there is a hereditary involvement definitely is there in Unmada.
Okay, sir, thank you. Next question. What are the treatment modalities adopted to make changes in Satwa of a person?
To change the Satwa of person, generally it is not treatment modalities, but rather it is Ahara, Vihara, such things. So it can be said as a treatment. But for an example, there are in Bhagavad Gita, it is said that Ahara that is good for Satwa and Ahara that is for Rajas and Ahara that is for Tamas. For an example, in case of Ahara, Yatayamam Gadarasam Uti Pajushidam Yet, that Ahara is called as Tamas Ahara. So if we are actually taking Yatayamam, an Ahara that is prepared already for a long time, generally that is a Tamas Ahara. And if a person is taking that Tamas Ahara, then the Satwa will move towards Tamas Satwa. And if you are taking Sattvika Ahara, which is said as mixed with a lot of Ghrita, such things, etc., and then that actually will move forward towards the Sattvika Satwa. And also it is said the same about Dana, about Shraddha, about Tapas. And if you are doing these things, Tapas, Dana, Shraddha, etc., in the Sattvic way, that will actually move the Satwa towards Sattvic. That is also the Talparya, or that is the interest of when saying Uttaret Atmana Atmanam. So we need to do that Udharana from a lower Satwa to higher Satwa using these attributes.
Thank you, sir. Question. Is there any relationship between Grahabada and Nakshatra?
Of course it is there. And also it is very much explained in Ashtanga Sangraha. Adhana Janma Nithane Pratyarakhe Chadushpade Nakshatre Vyadhi Ulpanna Kleshaya Maranayava is Ashtanga Sangraha. And Adhana is like Adhana Nakshatra. These are all concepts of astrology: Adhana Nakshatra, Janma Nakshatra, Nithana Nakshatra, and Pratyara Nakshatra. If the disease is coming in these nakshatra, in the same way, if the grahas are afflicting a person in these nakshatra, then they will be very much difficult to treat. It can even lead to the demise of the person.
Okay, sir, thank you. So next question. Is there any scientific rationality behind the application of Bhasma during dust?
Scientific rationality I consider, because our science is Ayurveda. So I hope that is based on Ayurvedic rationality. And when we are speaking about that, Vakpada says in the Bhuta Pradishetha, Bhuta Vijnaniya, it is said that the grahas generally afflict a person during sandhyas or the dusk time majorly. And our Bhasma Dharana is a defense, actually, a defense mechanism, which is given so that this Bhasma will protect us from the chance of having a Grahabhatha at the dusk time, because we cannot always maintain our Satwa in a very high state, or we cannot do that. So it is actually a common protection for people to wear the Bhasma in the dusk time or the dawn time, so that it will prevent the Grahabhatha that is happening in the dusk time. Why the Grahabhatha is happening more commonly at that time? It is because of the Nadyanu Pravesha of Ida and Pingala. That is completely another topic. So that is and in our experience, we are using this Bhasma Dharana, particularly for Pishacha Graha, which is almost very difficult to treat. But this is one of the things which we have found beneficial in Pishacha Graha, where we apply the Smashana Bhasma along with different mutras, and then actually doing the tilaka here in close to the Shrunkataka Marma. And we have seen some improvements of the condition just by the application of Asthma.
Thank you, sir. Next question. What is the role of Satwa in Graha Graha?
I think we have
Already explained.
Yeah, I think we have explained that.
Yes, sir.
Satwa is actually Ayurvedic psychotherapy, just to conclude that.
Thank you, sir.
Hope all the questions are over, it seems.
Yes, sir.
Okay, fine. So it was so nice to do the moderation or moderating the meeting or the presentation is, it was much difficult thing because most of the things are new to us, especially with the tantric and the other backgrounds, that those things are not so much digestible for us. But anyway, it happens. And your explanation was so nice. It was so informative and new era. As you are concluding in your concluding remarks, it's we should have a concrete approach on mental wellness. With Ayurveda, we can do a lot of things. There are interconnectivity between Ashtanga Yoga, Hatha Yoga, Tantra, Mantra, everything. And of course, Graha, planets, nakshatras, everything. Those are interconnected. Only that connecting link which we are missing now. That is what is happening now. And we are for the research. We are searching what is happening there, what may be there. Just searching means it is just observational study only. Only with observation we can get all the true knowledge. So with that, I congratulate Dr. Vikas Neelakandan for all his future endeavor in this field. Of course, he was praying for Shiva, Lord Shiva, with all his specialities. So let Lord Shiva, Lord Vadakanatha, give him all blessings. Namaste. Namaste.
Thank you so much, sir. Next, I would like to invite most respected Dr. P.V. Giri, Professor of Kayachikitsa Department, Vaidyaratnam Ayurveda College, for the concluding remarks.
Thank you, Dr. Suparya, and respected Dr. Vikas Neelakandan, Dr. Gauri Shankar, other faculties, PG scholars, and participants. Good evening to all. So, Dr. Vikas has given us a brainstorming session and detailed the description about the mantra, yantra, tantra, aushadha, asra, shastra is like that. So, Gauri Shankar was telling the Shiva here. In Kushtajigals also, Shiva Sudha, Tara Bhaskara Aradhanani, Prabhuda Malabhavam, Kushtamudbayande. So that is it. So the level of thinking has to be right. That is the achara that we strongly believe, especially the Indian philosophical approach is an important factor. That's what I believe. And Dr. Vikas has cleanly said about the Satwa and Prasanna Atmendriya, that is the harmony. That's a wonderful concept that has to be imagined like that only. Then Sir has given the sthana functions of the mind and gunas and the criterion classification and 16 types of sattvas. And about Nidana, while discussing the Graha, one more stress I am planning to give with due respect. Sir has given it Graha Chitra Praharinada. So the Chidra has an important role to play, not only in psychological factors or psychological diseases, even in body also, because if it can be considered as a decreased immunity in other diseases, and in psychological factors, the hereditary factors and the predisposing factors and the alpasatwa, that is the peer group relation, how he develops. So that can be also addressed. That is my opinion. With due respect, I am saying. So Sir was telling it, but I am giving more stress to that so that PG scholars may go through it once again. So that is why I am giving more stress. And Doshonmada and Grahonmada. So it has to be, Sir has got the difference. And whether it can be addressed as in relation to that psychosis and neurosis and the Graha alone, the personality disorders, that has to be also, I think, considered. And Sir was telling about the delusions, that exactly that's the same thing that I usually used to teach for the last several years. So that is the right thing, Sir has said. Adatva abhinivesha. That is, Tattva means Satya. Adatva means Asatya. Asatya abhinivesha. So the abhinivesha towards the Asatya. So delusions are false beliefs which continue to be held despite of the evidence. So exactly the same thing has been seen. So it's a part of only one symptom. So in lot of, even in schizophrenia and lot of other diseases, we can see all these things. So that also has been explained, and especially the treatment methodology when we go through. Sarah has given 1, 2, 3 case studies also, and the relation to Tithi Nakshatra. How far is scientific? That, see, evidence-based medicine is there, but if it is something is not proven, we cannot say that it is not correct, because we are getting, so that's the main thing. But nowadays we know that everything you believe is, and even Pune, one Sir has, I have done a PhD there. So one Sir has done with some mantras hypertension. So that was his PhD thesis. So I think that type of study has to be come out, so that at the same time we can prove the mantras are effective. So we know that this is effective. I know that, but without any evidence, nowadays the scientific community are, as all of us know, that's why we are studying the research and everything. So the students, the PG scholars has to think in that way. Whatever you believe it or not, you have to prove it. So negative finding is also a finding. So that is what, and in the, especially the Dhumana has an important role, and mantras, I said. So Sir has given a elaborate decision and the concept, and his talk was very confident because he has seen cases. I have not much gone through that mantras and everything, but we have to believe Sir, because he is doing it. That is what he has given the case study. So thank you very much for your sharing your knowledge, concepts, confidence to the students. So definitely it will improve our quality in education, as well as teaching, as well as the learning methodology, the concepts of behavior pattern of every person. Thank you very much. Thank you.
Thank you, sir. Next, I would like to invite most respected Dr. Navaneet Krishnan, Assistant Professor of Kayachikitsa Department, Vaidyaratnam Ayurveda College, for the vote of thanks.
Thank you, Dr. Supedia. Respected HOD, Dr. Gauri Shankar sir, Professor Dr. Giri sir, good evening to all. I'm considering this as an honor and privilege to extend the vote of thanks. Before entering to vote of thanks, I'm using this occasion to appreciate Dr. Vikas for the thought-provoking session he had shared with us. I think he can contribute a lot of things in Graha Chikitsa as well as Manoroga Chikitsa in future. While coming to the vote of thanks, I would like to thank respected Principal Dr. Lata Madam for giving permission for conducting this webinar. I would like to thank Dr. Arati for her welcome speech. With immense pleasure, I would like to thank Professor and HOD of Kayachikitsa, Dr. P. Gauri Shankar sir, for his solid support, timely monitoring, and also for moderating this session. Thank you, sir. I specifically thankful to Dr. Vikas Neelakandan for the wonderful session he had shared with us. I would also like to thank Professor Dr. P.V. Giri sir for his valuable, awesome conclusion remarks. I would like to thank all the participants that have registered for this webinar. Special thanks to Vishnu Ayurveda College Alumni Group for giving us the Zoom platform and other technical supports. I would like to thank all the teachers and students of Vaidyaratnam Ayurveda College for their participation and support. I would like to thank the whole team of Kayachikitsa, including teachers and PG students, for making this national webinar a great success. Thank you all once again. Thank you.
Thank you, sir. Once again, thank you all. And the session is over.